Hi there, JD here, talking about potential TRT side effects and elimination strategies. So let's get into it. So today, what we're going to talk about is to make sure that we can cover the fact that TRT, testosterone replacement therapy, the purpose of it is to kind of feel good and get benefits without having to deal with side effects. Some men do experience side effects from the therapy. Typically, if you are using the microdosing technique as described earlier, that will be limited, but some guys kind of do get these side effects, right? So what happens is some of these side effects are caused mostly by an imbalance between the levels of testosterone and estrogen, right? So uh, the testosterone is being aromatized a little too fast into estrogen, right? And that's why the best way to kind of reduce or prevent your side effects is kind of to work in line with the clinician and a physician who understands TRT and can kind of track you with the right tests to keep track of your hormone levels over time. Okay, so as we mentioned earlier, side effects when taking TRT usually happen because the therapy can affect kind of how your body creates and processes all the hormones, not just testosterone, right? So estrogen is actually composed of kind of three forms in the body, one of which is measured as by something called an estradiol or E2. At that's even present in male bodies, right? And so it's really important to overall health at certain quantities, and so you can kind of have negative side effects of too much and too little of this important hormone level. So the best way to kind of manage your estrogen levels is to make sure the doctor kind of starts out by doing tests to kind of get a sense of where your baseline is, and then we kind of follow on tests throughout the year to understand your body's ideal therapeutic range, right? Another kind of compound hormone is DHT, which helps the body process and understand testosterone signals. And it is important and relevant for sexual function, right? So, like estrogen, it is important to do the right testing at a proper cadence to monitor and manage your DHT levels. So, you may likely experience DHT related side effects if you're using transdermal TRT, like a gel or a cream, uh, or you're not microdosing with more frequent injections and injectable. If you're not microdosing or using more frequent injectable testosterone, you most likely, you will have a higher probability of side effects, right? So, that's something to kind of think about. And that's that. Okay. So good. So, as we think about kind of other hormones, right? Prolactin, something that kind of is in your bloodstream and can affect your testicles and overall cardiovascular chest right, health, right? And so the primary side effect you may notice if you have too much prolactin in your system is kind of a loss of libido or ED, right? Sexual side effects, especially after going on TRT long term. If you do notice those, you probably need to check this out. Prolactin is, mainly rooted in sexual function, and so a medication that improves prolactin levels can also naturally enhance, um, your libido as well, right? So the next thing we're going to talk about is something that most guys are like, oh gosh, right? And remember, this may not effectively happen if you were, like I said, microdosing and using injectable testosterone. It could happen, in terms of acne and hair loss. That could be potentially sped up or exacerbated by starting TRT. Typically, if you were to use a microdosing technique, right, so smaller injections, more frequent, lower dosing, right? So 3 to 5 times a week, right? This may not be an issue. For some guys, it is, right? So the two common most side effects, as kind of this mentioned, is baldness and acne. These are not life threatening, and in terms of kind of overall quality and health, those that get the side effects of these kind of find their or benefits outweigh the cost, right? But if you do want to kind of jump in and make sure that this is, you're not basically letting your male pattern baldness kind of go haywire, we would recommend a topical solution than a medication. Meds for baldness often cause their own serious side effects. Something that's interesting to know is this post-finasteride syndrome, and that's kind of a serious issue, right? That's affecting a lot of men today in the U.S., right? And unfortunately, a lot of those kind of meds can also render the benefits of TRT less effective. Some of them kind of artificially boost your total, but limit your ability to absorb it. So it's kind of making the TRT benefits less effective. Acne, that's a strange one because it could also be treated with a dietary, right, or changes or topical treatments. And so a dermatologist could help you if that is a key or that's an issue, right? So typically when going on TRT, they're the main meds that are used to reduce kind of the side effects are AIs and SERMs, right? You know, while these treatments can be meant to reduce side effects from TRT, they also come with their own side effects, and so they shouldn't be kind of a first solution to TRT side effects, right? And so we'll go over these two in greater detail in, the next kind of section, talking about kind of what these are and what they do. Long-term AIs aren't the best because if you use them from a long-term perspective, they do contribute to osteoporosis, so a decline in bone density. So we typically do not want to see patients on these long-term. However, they can help out with regard to mitigating the side effect profiles. Remember, I hate to keep repeating myself, if you are doing microdosing injectable TRT, typically there may not be a need for these. However, if you are, seeing side effects, these might be something to look into. Okay, so just section one, we really talked about the side effects kind of TRT are best managed under kind of doctor supervision, and by basically doing blood lab testing at the right cadence. So some clinics do once every 3 months, others do 3 times in the first year, and so forth. The right cadence can kind of help. If you are having side effects, it is probably best to treat and address them. And if they're especially impacting your quality of life, well-being, you need to kind of talk to the doctor about meds to enhance your TRT regimen and help balance your hormone levels, make sure your treatment's effective. Okay, so then we're going to go into kind of the next section, which talks more about SERMs, AIs, and weight loss. Right. So, as we mentioned earlier, the 2 most common treatments that can kind of accompany a TRT regimen are SERMs and drugs called AIs. Both of them typically just try to affect the estrogen levels in the body, so they can be a tool to kind of balance hormone levels if you're kind of suffering from an imbalance or side effects. Interestingly enough, weight, is also a major factor in the efficacy body fat percentage, right? So higher weight, higher BMI, and higher body fat percentage can put you at a higher risk for side effects, right? So here we're going to just talk about the other different mediums available for treatments and the way TRT interacts with body fat, right? So, as we think about, the 2 most commonly prescribed SERMs are Nolvadex and Clomid, right? So remember, what is a SERM? Selective estrogen receptor modulator, right? So, in talking about Nolvadex, for example, it really doesn't completely eliminate estrogen from your system. It kind of it basically lowers your estrogen levels, right? So it's probably less risky in terms of like the bone damage and joint health, right? Than and using it. When you do take it, you need to take it as long as you can eliminate symptoms, and do not take it any longer. Just kind of taper off of it. Clomid is sometimes another SERM prescribed to men whose sperm are not having kind of that motility, right? And not perform well. So it's still being researched, and it may cause some side effects in some men, and it may not be the most effective, right? So it's something to kind of explore. Monotherapy Clomid via Clomid. Okay, so AIs, okay, what's popular? Something called Arimidex and Anastrozole, right? These are often prescribed to guys on TRT, as I alluded earlier. What does it do? It blocks the ability of the body to produce estrogen, and unfortunately, it does have its own, panel of side effects. So, using it long term may cause you to not be able to balance your estrogen levels, and you might kind of experience moodiness, low libido, and moderate tension. Even when it is working, Arimidex long term reduces kind of good cholesterol, right, and bone density, right, so leading to osteoporosis, right. So long term, we kind of want to taper off it, right, and have a doctor monitor and keep your eye out on some blood lab tests to make sure that you're on point. A lot of times it doesn't make sense to kind of jump on AIs as soon as you start TRT therapy, mainly because when you start something, you want to kind of see how your body responds to it. And you always typically want to add one item or one med and kind of A/B test. So what do you like without it? What do you like with it? And so typically AIs are used or added after we kind of start to see some side effects, or alternatively, after you see something and observe some things, right? So it's not really recommended to kind of jump on. Some clinics try to do that, but we don't really recommend it. We practice kind of principles from the idea of essentialism. So really kind of going back to what is essential and building up as needed. Okay. So getting back to kind of another challenge we're talking about is, being overweight and having lower T levels are interconnected, right? So typically, obese men tend to have lower T levels, and increasing testosterone levels can, potentially lead to weight loss. The science behind it is because aromatase, which that is basically what converts testosterone to estrogen, is often found more in fat tissue. So the more fat tissue you have in your body, the more opportunities testosterone has to become estrogen. It leads to another reason why we prefer to do microdosing TRT, meaning smaller injections, injected intramuscularly in the delts. Why? Because when you inject in the delts, there's less probability of fat tissue versus glutes versus, stomach versus kind of, around that area and abdomen and so forth. And so because you're injecting into muscle, there's lower probability of that testosterone aromatizing to estrogen, right? And has a higher absorption rate. Research studies have proven that. So, in terms of weight-related issues like, metabolic syndrome, diabetes, that could also be some correlation to testosterone. Higher levels of testosterone scientifically have shown to kind of improve cardiovascular health and actually reduce the symptoms of diabetes and insulin sensitivity, right? So, if you have a high body fat percentage, or, you consider yourself to be overweight and are starting TRT, starting off with a small dose, right? Microdose, right? And can kind of help as you go on, and kind of picking up the good habits, drinking a gallon of water every day, kind of counting your macros, right? In terms of protein, fats, carbs, right? So dialing, the macros in, particularly in terms of weight loss, can help. Fasted cardio, right? Can help with coffee as well, to kind of, dial down the body weight and the fat and so forth, right? To, benefit you when you're taking TRT, right? So let's just go summarize what we talked about today, right? So a few things, right? So, if your doctor kind of wants to prescribe you, ancillary treatments or ancillary meds, you kind of need to understand the cost benefits and risk side effects of that, right? You really should work in terms of TRT with kind of a physician that kind of can oversee your blood lab tests in your body, right? Because it's good to get a second opinion. Messing with hormones long term can have medical consequences if it's not done in an appropriate and adequate manner, right? Lastly, kind of because body fat interacts with hormones in your system, guys that are having a higher body fat percentage may be at risk, for developing side effects and hormonal imbalances while on TRT, right? So, kind of monitoring body with appropriate testing, focusing on healthy habits, right? Weight loss strategies can kind of mitigate and eliminate this risk. Okay, thank you for your time, and hopefully you enjoyed this presentation about side effects and elimination strategies.